Mood and mental health play important roles in many aspects of women's lives, including physical health. So today, we're here to talk about the impact of mental health and physical health on the overall health of women. I'm excited to be joined by several experts. Let's dive in. Suzanne, what are some of the barriers to women seeking therapy today?
I think that there's a couple. I think one big one is time. A lot of women are working moms and they're also the primary caregivers in their homes. And sometimes going to therapy or treatment feels like another thing to add to the to-do list, and it can certainly get in the way. I think one of the really nice things that we saw that came out of the COVID pandemic was that you can get therapy online, which allows moms to do therapy while they're at home, while a baby's sleeping, or in between carpools, and we have greater access to resources now. I also think that there's still a stigma associated with going to therapy. The narrative around that is certainly changing, but a lot of times women think that they're not bad enough to go to therapy. And I would really like for women to see therapy as something that is a preventative part of healthcare and not just something that they go when things get really bad.
You know, you referenced women's stages in lives. So, Kate, women obviously go through many life stages and have different needs during those stages. So, what are things to consider with regards to exercise and how you choose the right exercise for those variety of stages?
Yes, I get this question a lot as a Pilates instructor, and my answer is first, we need to do what we enjoy. We're not likely to go participate in an exercise class if we don't enjoy being there and if we don't connect to that movement. And so I don't think that there is a hierarchy of which exercise program is the best. It is more about just moving your body. And first and foremost, I think you need to be able to connect and enjoy with that. That being said, I do think that there are things that we need to consider with women's health, and pregnancy being one, and that's generally not the time to start something really intense and new. Other things like osteoporosis that can hit later in life, that's a time to say, okay, I may not enjoy weight training, but it might be needed for your bone health. And so there are times where you look at the symptoms that you're having or the diagnosis that you're under or pregnancy or menopause and say, this is not the time to start something high intensity. This is the time to lean into something that I really enjoy and love and connect to. And then there are times to say, it's time to push myself to do something different for my overall health.
So, Dr. Hendricks, how can a woman's physical health play a role in her mental health? We talked about exercise a little bit. So what are some other ways that physical health impacts it?
Of course. There's a strong relationship between physical health and mental health. And like our other experts spoke about the importance of exercise, especially for women when you look at the history, the medical history. There's a history of minimizing women's symptoms, but I encourage women to pay attention to their bodies, and when you feel that something is off, to try and speak with a doctor, because there's so many factors that can influence mental health. Thyroid issues can cause problems with mood. A lot of times women deal with like premenstrual symptoms, and a lot of times it's kind of normalized to feel, kind of off or more irritable. But sometimes those symptoms can become so severe that patients may, experience psychosis and things like that. And even if, your mood is getting to the point around your period where you notice that you're not able to function at home or at work, there are medications that we can use to help alleviate those symptoms. So
that's great advice. Thank you. Suzanne, why the focus on women? So how is women's mental health different from men's?
Well, I think it has to do with a lot of what's already been said, and that women's bodies are different. And so women experience pretty significant hormonal fluctuations throughout their life, from puberty all the way through menopause, which is a huge chunk of a female's life. And some women are very susceptible to those hormonal changes. And so that is one of the reasons why we think that some women are really vulnerable to mental health issues during these hormonal milestones in their lifetime. All women have the changes. Some women are just really vulnerable to those changes. And so if we think about a woman's health without thinking about where they are hormonally, we're just missing a really big piece of the puzzle. So I think that's always something that has to come into the conversation when we're talking about how a woman is feeling and functioning.
That makes sense.
Yeah.
So I want to go back to something I think Suzanne and Dr. Hendricks that you both touched on earlier, which was the stigma associated sometimes with therapy or women feeling like they don't have the time. Is there anything either of you would like to add to those thoughts?
So many women kind of normalize how stressed out they are or how busy they are, or how much is going on, or that they're having hormonal changes. And they'll say, well, this is kind of normal, this is it. And maybe it is, but sometimes you have to slow down enough to realize how much is impacting you. And then slow down again to realize, okay, so what do I want to do about it? Because sometimes our priorities in our life have to change as we're going through different phases in our life. And if we just keep running through the hamster wheel, we don't really have a way to make effective changes in our life. And so that's a way that I work in therapy a lot, is how do you want to slow down and what do you want to do about this? Maybe some of these things are normal, but how do you want to be different? And we have to slow down and take the time to sort through that and figure that out. And I think maybe that's the piece that, I don't know if it's necessarily a stigma or a barrier to treatment, is that just so many women normalize certain things instead of, which you spoke about earlier, instead of saying, okay, maybe it is normal in some way, but I want to slow down a little bit and shift my priorities and do what feels right for me or my values and do something different and really move forward in a more intentional way. But that takes time and slowing down. Yeah.
Absolutely. And just to piggyback off of that, I would also encourage women to be an advocate for themselves. Sometimes when you speak with a doctor or provider, you may feel that, I still feel like something's off. I may hear that, it could be in your head, or if you feel that there is something going on, I would encourage women to, be persistent, stand up for yourself. There's also, with being a woman, you're taught, if you're strong, then you're abrasive, or if you speak up, you're considered to be difficult. But those are qualities that, especially when it comes to your health, should be valued. So I would also encourage women to be an advocate for their health.
Thank you so much. This was such helpful information, and we're very grateful for your time today. And we encourage all of you to spread this information by sharing it with others. Make sure that you are reaching out and checking in, because together we are united around mental health.